Hey loves, welcome back to my channel for another video. I am Kalesha if you are new, and I am a registered dental hygienist. I post content here on YouTube every Monday and Friday from faith-based to dental hygiene related. So if that's something you're interested in, be sure to go ahead and hit that subscribe button. If you are a returning subscriber, what's poppin'? I am back today to answer some of your questions. I posted a post under the community tab a couple days ago, probably about a week ago, telling you all to ask me some questions, and I also posted over on my Instagram and my Snapchat, so be sure to check the descriptions for those links, my social, and connect with me on social media. But I asked you all some of your fears so that I can debunk those or share some tips on how we alleviate anxiety here at the dentist. And before we get into today's video, I'm sorry if you hear a lot of drilling or a lot of noise in the background. I'm literally filming this video before my next patient comes, so sorry about that in advance. But without further ado, let's just get right into today's video. Alright, so I'm going to answer the first questions off of my YouTube community post. And I got quite a few, which was good. I'm excited. And there's some good ones. So I'm just going to start. First one I got, Alexandra said, hey, what was your hardest class in dental hygiene besides clinic? Love your videos. Thank you, girl. Ooh, y'all, I've been out of school. What? That's a question also. When did I graduate? I graduated in May of 2016. So I've been out of school almost 5 years now. I would say my hardest class other than clinic, because girl, obviously you know clinic is no joke, especially my clinic teacher that I had, it was no joke. But probably dental anatomy, maybe, where you have to know what tooth is which and the curvatures and all the anatomical variations to each tooth. I think that was the toughest class. Although I did really well in hygiene school, I think that was one of the toughest, I think. But yeah. Next question was from Aaliyah. Thank you, girl. You asked me a lot of questions in one, but I'm grateful. She was like, sorry I have a lot of questions, LOL. I'm just so happy to find a dental hygienist here in Mississippi on YouTube. Hey boo. So yeah, I'm glad you found me too. Okay, so it says, her first question is, what do you plan on doing after you decide that you are done with dental hygiene? Oh, that is a good question. You know, I hadn't really thought about that, but I can answer this. I have thought about going into sales part-time, and also possibly moving and either having my own clinic or doing some kind of mobile services. So stay tuned for that. Not sure just yet. But if I'm getting out of dentistry altogether, I probably more than likely have like my own business, my own non-profit organization or something like that. Or being a wife, period. Her second question says, what are your tips, your top tips and advice for dental hygiene students during and after the program? My top tips during the program would be to have a schedule as far as when it comes to balancing your social life and your school life, if that makes sense. Because hygiene school is not a walk in the park, but it's not terribly hard to the point where you just have to dedicate all your time to studying, but you do need to find that balance. So I would say your tips during school is to find a balance and stick to it. And then after the program, don't be intimidated by the work world. And what I mean by that is when you're fresh out of hygiene school, you're used to taking your time on every patient. Like you probably get a patient at 8 and you can see that patient till 3 o'clock. I know it's ridiculous, but in the real world, it's 1 hour max with that patient. So you need to make sure that you aren't, intimidated by the fast pace of how you have to work, and be able to be flexible and adjust to different doctors and different needs per se in the office that you work for. So all that said, in school, balance your work and social life. Out of school, don't be intimidated by the fast-paced workforce. Okay. Ooh, and some more advice for when you're out of school. Really do your research on private practice versus corporations. And if you want, let me know down in the comment section if you want me to make a more detailed video on that subject. Her third question said, I live in Mississippi as well. Is it hard to find dental hygiene jobs since Mississippi is a smaller state? I didn't have this problem, and none of my classmates had this problem back in 2016, but I do understand what you're asking. As far as where I was in the Mississippi Delta, which is very limited on jobs as a dental hygienist. So I would say if you find the right state in Mississippi, I don't think it'll be very hard to find a job. And also your license will cover multiple states if you decide to move, so that's always a plus. Her fourth question said, did you work while you were in the program, being that it's time consuming and you have to be focused? That's a good question. I feel like my first year I worked some weekends. They do recommend that you don't have a job because you're in school most of the day from 8 to 5. That's pretty much your job. School is pretty much your job. And then of course you're gonna want to study during the downtime you have. So I do not recommend having a job, but hey, if you can pull both of them off, kudos to you, sister. Kudos to you. And her last question says, could you make a video on how to study for the TEAS test, and was it hard? Girl, I'm gonna just be honest, I ain't studied for that TEAS test. I mean, it was kind of like a knockoff ACT, if you ask me. So however you would study for the ACT, which I also never studied for that, I'm probably not the person you want to go to when it comes to asking about study tactics and stuff, because I just showed up. As far as when it comes to the ACT and the TEAS test. Honestly, I never studied for either one of them. So but I will say it's not as hard as ACT, and that's all I can really say. I don't really remember it, sis. I don't remember it. Sorry, I'm not much help in that department. But thank you for all your questions. That was her last question. And then I also got a question that from, sorry if I messed his name up, but it's Music Craze 66. Sorry. Either way, they said, would you recommend asking officers to shadow at this time? I've been hesitant to ask because I don't want to seem insensitive of the pandemic. I would say it's okay to ask officers to shadow at this time, because, you know, although we are in a pandemic, you still have qualifications that you need to get accepted into whatever dental hygiene school it is that you're applying to. So I think it's okay to ask. You know, they can either tell you yes or they can either tell you no. So I think it's okay to ask, and just kind of let them know that you'll stay back, and you know, you can practice social distancing and you can keep your mask on because you're not the one having to work, you're just observing. So I think it's perfectly fine if they allow it. I think it's perfectly fine to ask if you can shadow. Ooh, let's find some more. Okay, also got a question from Jeffries Anitra that asks, what state am I in? Mississippi. Also got a question from Skylar Johnson. He said he's been interested in becoming a dental hygienist, but he noticed that he was going to be the only guy in his class. Do I have any advice? Go for it. Go for it, Skylar. I don't know. I don't personally know any male dental hygienists, but I did, however, do my boards next to a male hygienist, and there were a couple more from different schools, and I think it's accepted this day and age. You know, I don't think there's anything wrong with the male hygienist. I say go for it. You want to be the black sheep, baby. You want to be you want to stand out. You know, you don't want to mesh with everybody else. You want to stand out. So I say go for it, no matter if you think it's a female profession, just like dentistry was a male profession. And most dental classes now are not even 50-50 men and women. It's like 80-20 women over men. So hey, same thing, dental hygienists. You know, we have a lot of women in the field, but we need some men. We need some men around here. So let's level the playing field. So I say go for it, Skylar. Okay, on my last video about what a dental cleaning looks like up close, I got this comment that said she didn't leave the room when she took the x-ray. Alright, so we use this gun called a Nomad. Let me get it so I can show you. It looks like this. This is the Nomad, and we have to hold it to expose the x-rays. So, sweetie, there is no possible way to leave the room when taking an x-ray. But those Nomads put out very little to no radiation, so that's why we're safe to stand in and take them all day. And we also give our patients the option of wearing a lead apron. Most choose not to, just because of the advancement in technology is not really necessary. And to be honest, you get way more radiation exposure by standing out in the sun or standing in front of your microwave while you're cooking that dinner. Alright, also got a recommendation to film an oral cancer screening, so be on the lookout for that soon. Thank you for that recommendation, John. Also got a question from Kimberly that says, which Sensodyne toothpaste should I use for sensitivity? Well, Sensodyne is for sensitivity. That's a brand that's targeted specifically for sensitivity. You know, Sensodyne works for some and for some it doesn't. There are some prescription strength toothpaste that you can only get in a pharmacy or from your local dentist. It's called Prevident and Floridex. So I highly recommend those for sensitivity. Those are the only ones that each patient that is used to said it works tremendously for them. But if you just have to have something over the counter, I mean, the regular Sensodyne does it, you know, I guess. Hope that answered your question, Kimberly. I got a question on my previous video, the Opalescence Boost step-by-step. They asked how much does it cost. Here at our office it costs $350, and included with that is a take-home whitening strip tray, whitening toothpaste, as well as a sensitivity whitening tray. A sensitivity tray, just in case you get any sensitivity after. So that's $350, but it probably will vary from state to state, office to office. So you may want to call your local office and see if they offer that service and what theirs cost. Okay, and she also asked, does it work on teeth that have decalcification? Yes, it works on teeth that have decalcification, but the decalcification spots, which is the white spots that you already have, which is weakened enamel, it will usually make the decalcification spot wider, and the teeth around it will not match that wider spot. You get what I'm saying? So it's not gonna bring the surrounding to the shade of that decalcification, but it will whiten around it, yes, but it will not match. It'll just brighten the decalcification, you know. All right, so that's pretty much all the questions I got. Those were some really good questions, but I also got some kind of like fears or why people may have anxiety when it comes to the dentist. So I'll go ahead and jump right into that. I got one girl that says the whole vibe just scares me. I think that is so funny. She wasn't specific enough, but the whole vibe, I kind of want to let you know that you may just want to kind of shop around at some offices. Look at the aesthetic, look at the employees and all of that, and kind of get you kind of want to be in a warm and welcoming environment. I get it. The vibe sometimes is cold, it's sterile, everybody giving you looks like, bitch, your mouth messed up. So you want to find a place where either you know someone or you've heard good reviews from them, and then you kind of go get the feel, maybe go with them to one of their appointments and kind of get to know the clinicians a little bit, and then kind of work your way in it from there. But you do want a nice ambiance when you walk in the door. Here at my clinic, we have different candles burning in every room because the aroma helps relax you. We have soothing music, we have stress balls, we have a lot of stuff here that we use to alleviate anxiety. So just find that office. It's an office out there that the vibe won't be scary. Also got a girl that says, I fear the dentist is going to tell me I need false teeth. Baby, the only way he gonna tell you need false teeth is if you not going to the dentist, sis. So you have to put it in your routine to start going to get preventative care, which is your cleanings, your x-rays, just so we're able to find anything small before it turns into something so big that you need false teeth, if that makes sense. Also got most of the bulk of the anxiety and the fear of coming to the dentist is needles. I mean, and I really can't, if you're deathly afraid of needles, you may want to just go to a hospital setting, somewhere where they can sedate you, put you to sleep, do what they got to do, you wake up and it's done. But if you think you can kind of still do it, but you're kind of nervous about it, we do have some type of like kind of, you know, we have a system called nitrous sedation, which is you're awake but you're sedated. It's kind of almost like you just smoked a little weed or a little marijuana, and it kind of have you a little loopy, but you're alert, you're able to talk and respond and things. You know what's going on, but you don't, if that makes sense. You just kind of cool and collect. Also, your doctor can prescribe you some Valium or something like that that'll calm your nerves before you come. We also, to make sure the injections are comfortable, we also place like numbing jelly before the needle comes. That way the jelly that we rub there go ahead and numbs that area so that the injection is usually painless. Also, we have stress balls that you can hold and squeeze. If it's still a little pressure for you, you can hold and squeeze that way. And that's almost about it, what we have at the dental office that can help you. And you want a clinician, again, that you're comfortable with, that will take their time and they're not in a rush and they care about your well-being. So just shop around, y'all, for dentists. I mean, you need to. And somebody said, I've always had traumatic experiences there, and I kind of want to talk about that briefly. I mean, at some point you just got to forgive and forget. You know, it's kind of like saying, oh, I've had my heart broken by this man, but I'm gonna talk to this man even though my heart may be broken again. You know, you trust in it. So that's the same thing when you go to another dentist. You just don't go back to that one. You go to another one, and then you kind of try to put your trust in them and then see if they take care of you. But you got to do it. The dentist is necessary, y'all. It's necessary. So I do recommend that you try to, every experience is not going to be the same. So I do recommend that you try to find another dentist that's nice, that's accepting, that can take care of you, because there are some out there. So I think that's pretty much all the comments and the questions I got. I hope this video was helpful in some way. Be sure to give it a thumbs up if you learned something new. I have gotten a lot of new subscribers from my most recent dental hygiene video. So thank you so much. You all are inspiring me to bring my camera to work and capture what I do on a day-to-day basis. And I think it's very interesting. So be sure to always contact me either on social media or down in the comments and ask your questions. Thank you for tuning in to today's video. I'll see you all in my next one. Bye, loves.